Good afternoon, everybody. It's now 11 o'clock, so I will start the webinar. First off, I want to welcome you to the ARTA and the ARTA Benefits Plan webinar. My name is Jennifer Hope, and I am the Manager of Marketing and Promotions at ARTA. We're also joined today by Amanda Shaw, who's our Chief Marketing Officer, and she'll be available to help answer any questions that you might have through the webinar. I am recording this webinar because we will post it on our YouTube channel so you can view it in the future. So if you have any questions throughout the webinar, please use the Q&A function in Zoom. So it's just those two little speech bubbles in your Zoom menu. So just type your question into there and Amanda or myself will get to the question. Also, you've noticed that your microphones and video have been disabled. This is just to ensure your privacy because we will be posting this webinar on our YouTube channel. So today I'm going to talk to you a little bit about ARTA. I'm going to talk to you about our membership advantages that you receive when you become an ARTA member. As well, I will do a deep dive into our benefit plans that we offer to our members and how to apply to ARTA. So just to start out, just a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers by retired teachers. However, we've obviously expanded our offering to similar groups. We have a public and private sector. So our public sector is where the GOA employees would land. And we offer our benefit plans to similar groups that hold the same type of insurance risk as a retired teacher would. So we offered our benefit plans to similar groups, such as GOA employees, to ensure and maintain the stability of our benefit plan. We have been the sponsor of our group benefits plans since 1995. We also self-administer our benefits plan. So everything is done under one roof. ARTA is a one-stop shop. You don't need to worry about calling numerous people. You can call our ARTA Member Services team members if you have any questions, because everything is done under one roof. We have over 30,000 members on our benefit plans, and we cover over 46,000 lives. Our provincial office is located in Edmonton. However, we have just opened up a satellite office in Calgary. So if you are in Edmonton or Calgary, feel free to stop by our office and schedule a meeting with one of our member services team members if you want to sit down and meet face-to-face. You're also able to go visit arta.net and schedule a virtual meeting if you would like, but you can always call ARTA at any time if you are unable to do a virtual meeting or come in face-to-face. It's up to you. So there is a fee to becoming an ARTA member. In ARTA's public sector, the fee is $50 a year. And if you do get our benefits, that's $4.17 added onto your monthly premiums. And by becoming an ARTA member, you are able to gain access to our benefits plan, but we also offer some really great membership advantages. One of ARTA's strategic goals is wellness. So we like to ensure that our members are living a healthy and active and engaged lifestyle through retirement. So we offer a variety of wellness initiatives throughout the year just to ensure, to keep your physical self well and your mind sharp. So we offer a photo contest. We have physical wellness initiatives throughout the year. And we also have a really great writing contest. So our members are able to submit their work to these initiatives and receive some really great prizes. We also have a really great member discount program. We recently brought our discount program in-house because we want to ensure that our members are receiving the best discounts out there for hotels, restaurants, different attractions, tickets to different events. So if you use your ARTA Perks member discount card, once or twice, your ARTA membership would have paid for itself. We also have a really great scholarship program. ARTA offers scholarships to our members' direct relatives, so any children, grandchildren, nieces, or nephews. We award 8 scholarships throughout the year, $5,000 each. So this is ARTA's great way of ensuring that our members' direct relatives and supporting them in their post-secondary education. So now I'm going to talk about our benefits plans. So our group plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retiree's lifestyle. When people retire, we know that they are so excited to go travel because you're no longer bounded by your vacation time or when you can take time off throughout the year. You can travel whenever you want for as long as you want. So the ARTA Benefits Plan has some really great competitive emergency travel coverage. ARTA's emergency travel coverage is extremely unique because we do not have any stability clauses for pre-existing conditions built into our emergency travel coverage. And I will go through that thoroughly in a couple slides here. Also, ARTA is a not-for-profit organization, so any premium that comes into ARTA goes back to administrating the plan and back to paying out any claims that our members do submit. There are different plans out there that will offer you a discount if you join at a certain period of time. ARTA does not offer any discounts for our plan because we do not have any of those profit margins built into our premiums because we are a not-for-profit organization. So there are some eligibility requirements that you need to meet before becoming an ARTA member. If you are vested to receive a pension plan, so a government-sponsored pension plan, so that's LAPP, PSPP, MAPP, you're eligible to join ARTA. You need to be an ARTA member, so you have to pay that $50 a year, but you do receive those really great membership advantages. You need to be a Canadian resident covered by your provincial or territorial health insurance within your province of residence. We have members throughout the country. If you decide to retire in Alberta, but you're sick of our -40 polar vortexes and you want to move to BC to enjoy a little bit of a more warmer climate, you can do that. And your ARTA Benefits plan will follow you. Or maybe you have family on the East Coast and you want to go, move there, that's great. The only province where ARTA Benefits Plan do not work is in Quebec, as their provincial healthcare plan does not work in tandem with our ARTA Benefits Plan. There's no age restriction to joining ARTA. You can join ARTA at any age, and you can stay on the ARTA plan until as long as you want. Last I checked, our eldest member was 103 years old. But also just so you know, if with our emergency travel coverage, there's no termination ages within our emergency travel coverage. So when you are looking at different plans, make sure you are looking at those termination ages. Because I know I would like to travel well into my 80s. So with the ARTA Benefits Plan, we do not have any age restrictions. Your eligible dependents are able to join ARTA, as well as your surviving spouse. So if you're eligible to join ARTA today, and if something were to happen to you, your surviving spouse can join ARTA. Also, if you do join ARTA as the primary cardholder and you do have a spouse on your benefits plan as a dependent, and something were to happen to you because as the primary cardholder, your surviving spouse can continue on with their benefits plans. We do not terminate any surviving spouses. So again, when you are looking at different plans, make sure you are looking at those surviving spouse termination rules. ARTA will not terminate your surviving spouse. So applying to ARTA is easy. I typically suggest to people, if you know that you are going to be losing your employer-sponsored benefits, try to get your application into ARTA about 4 to 6 weeks before losing those benefits. So if you know you're joining ARTA, apply to ARTA. It's really easy to do. You can do it online or you can do it through mail. It's entirely up to you. But it is very important to apply within 60 days of losing your employer-sponsored benefits. Because if you do apply outside of that 60-day window and you would like a plan that offers emergency travel coverage, you would need to fill out a medical form, a medical questionnaire, and Beneva, who is our emergency travel provider, they'll determine whether or not you can join on one of our plans that offers emergency travel coverage. So just get your application in early so you don't need to worry about any of that stuff. We know that not everybody retires at the same time as their spouse. And if your spouse is continuing to work and they have sufficient benefits for you as a dependent, join their benefits plan, continue being covered by their employer. However, when your spouse loses their employer-sponsored benefits, make sure you apply within that 60-day window. Or perhaps you decide to retire and you decide to get employment elsewhere. Maybe you have a hobby building things, so you get an employment at Home Depot or a quilt store, whatever it may be, and that employer offers benefits. That's great. Take those benefits. But once you lose those employer-sponsored benefits, just make sure you apply within that 60-day window. And the date that you indicate on your application when your employer-sponsored benefits are terminating, your ARTA benefits will start the next day. We do not have any waiting periods. We don't want our members to have any lapse in coverage when they are, losing their benefits with their employer and joining onto ARTA. We want to ensure that our members are always covered. So now I'm going to talk about the different plan options that we offer to our members. So we have two sort of umbrellas for our members. We have our comprehensive plans. And our comprehensive plans were developed for members who are under the age of 65. When you're under the age of 65, you aren't eligible for the Alberta Coverage for Seniors plan yet. So these plans offer some higher level of prescription drug maximums. They cover a little bit of everything, extended healthcare, travel, as well as dental care. We also have our build your own plans, and our build your own plans allow for a little bit of customization. Maybe you want travel, maybe you don't want travel, maybe you want dental, maybe you don't. But these plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. When you do turn 65, you are eligible to join that Alberta Coverage for Seniors plan. And the Alberta Coverage for Seniors plan becomes the first payer in prescription drugs, and then ARTA becomes the second payer in prescription drugs for drugs listed on the Alberta Drug Benefit List. But I'll talk about that a little bit further as I move on in the presentation. But first, I'm going to talk a little bit about our comprehensive plans. So our comprehensive plans are available for members under the age of 65. We have 3 different levels of coverage, core health being the most basic of the 3, essential health, and enhanced health being the most comprehensive with some higher maximums. All of our plans offer single, couple, and family care coverage. So depending on your family situation, there is a plan for you. And all of the annual maximums in these plans are per covered person. So if you and a spouse join the plan, you each receive the annual maximums. They're not split in half. You each receive that annual maximum for that benefit. So our overall coverage level for our comprehensive plans is 100%. So if you submit a claim to our comprehensive plans, you'd be paid out at 100% unless otherwise indicated. The overall annual maximum ranges from $10,000 all the way up to $15,000 annually. So I'm just going to go through a couple, most popular benefits and benefits plans in our comprehensive plans. However, I want you to know that ARTA does cover a long list of benefits. These are just a few line items that these plans cover. We have a long list of different medical aids and supplies that we cover. We cover vision, hearing aids, CPAP machine. But I'm just going to go through a couple popular points in our comprehensive plan. So your prescription drugs would be covered at 80%, ranging from $1,500 a year all the way up to $5,000 a year. I know a lot of people don't actually know how much money they have been spending on prescription drugs because your employer-sponsored plan has typically been covering a large chunk of that. So what I suggest to people is go to your pharmacist, say, hey, can you give me maybe a 2-year average of how much I've been spending on my prescription drugs? And with that information, you can make an educated guess on which plan might work best for you, because then you'll know how much prescription drug maximum that you might need. Paramedical services are covered at 80%, ranging from $750 in core health all the way up to $1,500 a year in enhanced health. Our paramedical services practitioner annual maximum is a little bit different from other plans. This is a combined annual maximum. So paramedical services are those practitioners that offer massage, chiro, physio, counseling. ARTA covers a list of 12 different practitioners. And you can use that annual maximum as you see fit for those practitioners throughout the year. So maybe you're somebody who really enjoys getting massages. You can spend, if you had Essential Health, for example, you can use that $1,000 just on massage. It's entirely up to you, but then just know that you wouldn't have an annual maximum left over for that chiro, counseling, acupuncture. You can spend $800 a year on massage, and then you'd have $200 left over for those other practitioners. A lot of plans allow you to have, $500 for massage, $500 for chiro, $500 for counseling. We've done a little bit of research, and we know that members only use 1.8 practitioners annually. So we want our members to use that annual maximum where they need it. ARTA offers $1,750 coverage for diabetic supplies. This is a little bit different because diabetic supplies is a separate line item from prescription drugs. So if you are an insulin-dependent diabetic, make sure when you are comparing plans, make sure to see if you do have your diabetic supplies covered aside other than your prescription drug maximum. Our comprehensive plans do include our 92-day emergency travel coverage with no stability clauses for pre-existing conditions. And again, I will talk about that further in a couple slides here. Also, you're eligible to join our supplemental travel coverage under our comprehensive plans if you are taking a trip longer than 92 days. Our comprehensive plans also include some dental care coverage. So if you can receive 80% coverage for basic, preventative, and minor restorative work. So those are your exams, your x-rays, your cleanings, polishings, fillings. Also, our enhanced health plan offers 50% coverage for major restorative work. So that's that lovely dental care work where you're getting crowns, onlays, implants, dentures. Also in our enhanced health plan, maybe you have some dependent children who are at home that still require some orthodontic work. So enhanced health plan might be the best plan for you if you are in that situation. Our enhanced health plans offers 50% coverage up to a $2,000 lifetime maximum. So maybe my son just got a spacer, so I know how expensive orthodontic work can be. So just take a look at your situation and choose a plan that's best for you and your family. So now I'm going to talk about our build your own plans. So our build your own plans do allow for some customization. So as mentioned before, when you are 65, you're eligible to join the Alberta Coverage for Seniors plan. And if you only had the Alberta Coverage for Seniors plan, that plan will pay up to 70% for prescription drugs listed on the Alberta Drug Benefit list. And then you would be responsible for a 30% copayment up to $25 out of pocket. But if you have the Alberta Coverage for Seniors plan, who's the first payer in prescription drugs, and an ARTA Benefits plan, and you coordinate those two plans, those drugs that are listed on the Alberta Drug Benefit list would be covered at 100%. ARTA also covers a long, robust list of prescription drugs not listed on the Alberta Drug Benefit list, and those prescription drugs would be covered at 80%. So with our build your own plans, so we do allow for a little bit of customization. We have two plans that do not offer emergency travel coverage, HealthWise and HealthWise Plus. So maybe you're someone who doesn't want to travel at all. So a plan, HealthWise or HealthWise Plus might be the best plan for you. We have two plans that do include our 92-day emergency travel coverage, Total Health and Ultimate Health. HealthWise Plus and Ultimate Health have some higher maximums for vision care, hearing aids, paramedical services, and they also offer some coverage for defined lifestyle medications, so hair loss, erectile dysfunction, or weight loss medications. Also, with our build your own plans, for your prescription drugs, you're required to choose an annual maximum of $1,200 or $2,000. At first glance, you might be like, hey, that doesn't seem like a lot of annual maximum for prescription drugs. But as I explained before, the Alberta Coverage for Seniors plan, if you are 65, is the first payer in prescription drugs, and then ARTA becomes the second payer in prescription drugs. So that $1,200 or that $2,000 annual maximum does stretch a really long way. 93% of our members who are on a build your own plan don't actually meet that annual maximum. So when you are looking at your situation, just keep that in mind. Paramedical services, again, are covered. So it's that annual combined maximum, 80%, $1,200 under HealthWise or Total Health, and then $1,400 under HealthWise Plus or Ultimate Health. Again, a long list of medical aids and supplies are covered under a build your own plans. A lot of people do ask me, hey, what's your most popular plan? Total Health is probably one of our most popular plans amongst our members. So that includes your extended health care and emergency travel coverage as well. These plans, again, offer single, couple, and family care coverage. Also, with our benefits plans, you are always able to move up in coverage. But once you've moved up in coverage, you are locked in for 24 months. So maybe you start off with a total health, but you see that you're reaching your paramedical maximum, your vision maximum, your hearing aid maximums annually. Then you can move up to ultimate health if you want. But once you've moved up, you are locked in for 24 months. Also, if maybe you decide to start with a $1,200 annual prescription drug maximum and something happens and you're prescribed some more medications, you can always move up to that $2,000 annual maximum level. But once you've moved up, again, when that maximum prescription drug maximum, you are locked in for 24 months. So with all of our benefit plans, we also offer some really great additional resources. We offer a virtual physician service. You're able to meet with a physician online. You can pick up the phone. You can tell them about what's happening with you, and they can help you, guide you along with the process, and perhaps provide you a prescription. We all know how hard it is to get into our physician. Sometimes it's months and months on end that you can't get in. So this is a really great program. If you do fall ill, you can call these virtual physician services and meet with a physician online, and they can help you out. We also have a really great member assistance program. So you might have an EFAP with your current benefits plan. And our member assistance program offers 5 hours of free counseling every year, as well as 5 hours of free couples counseling every year. We all know the past couple of years have been really difficult for everybody, so you might need that extra assistance. And this is on top of your paramedical practitioner counseling maximum. We also have a really great healthcare navigation program, ARTA Cares. It is very difficult navigating the healthcare system. Perhaps you might need a second opinion for an illness or an ailment that you might have. Maybe you need some help, figuring out who to call. If you have a parent that might need, help getting into a long-term care facility. And the ARTA Cares is powered through Humanicare. So you just need to pick up the phone. A registered nurse will help you navigate the healthcare system because it is very confusing. So these are some really great additional resources that you do receive with one of our build your own plans, as well as a comprehensive plan. So ARTA emergency travel coverage. So if you are joining one of our plans that do offer emergency travel coverage, so our comprehensive plans or a total health or ultimate healthcare plan, you are receiving access to some of the best emergency travel coverage there is in the country. The ARTA emergency travel coverage plan is extremely unique because we do not have any of those stability clauses for pre-existing conditions. A lot of different plans out there will require that you're stable from a prior health condition for 90 to I've even seen 365 days. So for example, perhaps you have a change in medication. Maybe your doctor deprescribes your medication or increases the dosage on a prescription that you are taking. And you have a trip planned and you go on that trip and something happens because of that change in medication. But if there was no cause for concern, both you and your doctor feel that you're well enough to travel, go on that trip. And if something were to happen because of that change in medication, you would be covered for that because that would be considered sudden and unforeseen. Maybe you had a prior health condition, but there's no cause for concern. You and your doctor feel that you're well enough to go and something happens because of that prior health condition. The ARTA emergency travel coverage, you would cover you for any of those issues because of that health condition, even if you aren't stable for a certain period of time. So when you are comparing different benefit plans, make sure you are closely looking at those 90 or even higher stability clauses for any pre-existing conditions. If you do have a medical emergency outside of your province of residence, ARTA will cover 100% of those eligible expenses up to a $5 million lifetime maximum. That $5 million lifetime maximum, no one's ever come close to reaching that maximum. So just know that if you do go on your trip and you do have an emergency, that $5 million lifetime maximum will keep you well covered. You're covered for any 92-day trips you take outside of your province of residence. We know a lot of our members love to travel to sunny destinations where they have second homes, maybe in Palm Springs or Phoenix, and they want to be longer for they want to be gone longer for 92 days. That's great. You can. We offer supplemental travel coverage in 15-day increments up to 212 days. So it's always better to have that additional emergency travel coverage before you go away on your trip. However, if you're on a beach in Mexico and you're at day 90 and you have not submitted a expense under your emergency travel coverage, you can call ARTA and ARTA will add those 15-day increments. However, sometimes that supplemental travel coverage can get a little bit pricey. So what some of our members do if they are in a place like Palm Springs or Phoenix, they find a cheap flight back to their province of residence, ensure that they hold on to proof that they did cross back into their province of residence. So a receipt from a Starbucks at the airport, or hold on to your boarding pass, just make sure that you have proof that you did cross back into your province of residence. And that 92-day is an immediate reset. So you're not required to be in your province of residence for a certain period of time for those 92 days to reset itself. Also, that's really unique with the ARTA emergency travel coverage is we offer trip cancellation and interruption insurance. So maybe you do visit your doctor to ensure that you're well enough to go travel, and that your doctor says, you know what, I'm uncomfortable, you're not well enough to travel. I don't suggest that you travel. We want our members to go travel when they're healthy. We want them to enjoy their trips, which is why we have this trip cancellation. So if you do fall ill and you need to cancel your trip, we offer $10,000 per insured person per incident. Or maybe your home suffers a flood or a fire and you're unable to travel. Just know that you have that cushion for you with ARTA's trip cancellation and interruption insurance if you do need to cancel your trip. Again, also the ARTA emergency travel coverage does not include a termination age. A lot of plans will terminate your emergency travel coverage at the age of 80 or 85. So again, when you are looking at different plans, make sure you are looking at those termination ages, because I know I want to travel well into my 80s, and I hope some of you do too if you if you do have a plan that offers emergency travel coverage. So our build your own plans do not include dental care to allow for a little bit more customization. So we offer 3 standalone dental care options, option A, B, and C. Option A being the most comprehensive and option C being the most basic. Our dental care plans also offer single, couple, and family care coverage, and you are able to move up in coverage. But once you've moved up in coverage, you are locked in for that 24 months with our dental care plans as well. So option A offers 80% coverage for basic, preventative, and minor restorative work, as well as 50% coverage for any major restorative work. Option B offers 80% coverage for that basic, preventative, and minor restorative work and no major restorative coverage. And option C offers 65% coverage for that basic, preventative, and minor restorative work. You're not required to add dental care onto a build your own plan. You can add it at the beginning, you can add it later on down the road. It's entirely up to you. But just keep in mind that if you do apply to one of our dental care options outside of the 60-day window of losing your dental care with your employer, your annual maximums will just be prorated to January. So at ARTA, we know that it can be confusing building a benefits plan that's best for you and your family. So we have a really great website, artabenefits.net, that will help guide you through that process. If you visit artabenefits.net and you can click on the Alberta logo, it will take you to the Government of Alberta landing page, and you can click on a Build Your Benefits tool. And that Build Your Benefits tool asks you a series of questions. It will ask you if you're over 65, under 65, whether you want travel, whether you want dental. It's entirely from the questions that you do answer, a chart will populate with all of the benefits plans that are available to you, as well as the monthly premiums. And once you choose a benefits plan, you can apply online through artabenefits.net. It's a really quick and easy process. Also on artabenefits.line, you can find our benefits booklets. And our benefit booklets, they're long documents that'll explain every single benefit that is covered through the ARTA Benefits Plan. You're also able to view a rate sheet. So if you click on benefit booklets in the footer on artabenefits.net, and you can click on the public sector rate sheet, and it will show you all of the rates available for all of our benefits plans. So that's all I had for you today. Amanda and I will stick around and answer any questions that do come up through the chat box. Through the Q&A function. Also, if you would like us to mail you an enrollment kit, and an enrollment kit has our plan options brochure, which outlines all of the benefits plans available to you, explains a bunch of different situations and which plan to choose. It also includes all of the information you need to know about ARTA and applying online. The enrollment kit also has a rate sheet, as well as a really great retirement guide booklet. So if you would like us to mail you one of those, please email join@arta.net. Or if you have any questions, you can email join@arta.net, or you can reach our member services team at info@arta.net. And again, this webinar is recorded and it will be posted on our YouTube channel probably in a day or two. So that's all I had for you today. Again, we'll stick around and answer any questions that you might have. But if you don't have any questions, I hope you have a lovely afternoon. There have been a couple of questions about applying within the 60-day window. So if you are losing your employer-sponsored benefits on June 28th, if you apply 60 days after you lose those employer-sponsored benefits and you want a plan that includes emergency travel coverage, you would just need to fill out a medical questionnaire from our emergency travel partner, Beneva. But if you apply to ARTA before that 60-day window terminates, so if you apply 4 to 6 weeks before you lose your employer-sponsored benefits with the GOA, you don't need to worry about that medical questionnaire. However, if you would like a benefits plan that does not include emergency travel coverage, you will not have to fill out a medical questionnaire after that 60-day window.
You can also apply as far in advance as you want. With our teachers, we say it's a great spring break project. Sit down, fill it out, submit it well before you lose your coverage. We'll hang on to your application, process it, and we'll start the day after you lose your coverage. There's also been a lot of questions about membership. You don't have to be a member in advance of accessing benefits. So when you fill out the application, it's actually an application for both membership and benefits. Your membership in ARTA will start the same day as your benefit coverage. The reason for our membership is because we are a closed group benefits plan. It helps us maintain our risk profile, which allows us to offer the benefits we do at the rates that we do.
Okay, I don't see any other questions coming in. Thank you for joining, Amanda and I. If you have any questions, please email join@arta.net.